What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for November 23, 2020. Racism and Health Series Part 1, The Impacts of COVID-19 and Racism on Kids, Education and Health. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Keisha Pollock Porter, the Vice Dean for Faculty and a professor at the Johns Hopkins Bloomberg School of Public Health. I'll be hosting a periodic series on the impacts of racism on health. In this first installment, I sit down with Mr. Taylor Porter, a principal at Gamble Montessori High School in Cincinnati, Ohio. As part of our conversation on racism, education, and health, we discuss how COVID is impacting his students. All right. So I'm here with Mr. Taylor Porter, who is the principal at Gamble Montessori High School in Cincinnati, Ohio, to continue our conversations around racism and health. And Mr. Porter is the principal at this high school, and I'm excited to speak with him today because this is a big day. It is the first day kids are back on campus, about 2 months after they would normally be there. So how is it? How are you feeling today, Mr. Porter? How's everything going?
You know what? I feel excited, and I think that excitement is mixed with just a little bit of nerves. Mm-hmm. We're in this new era of education, and like safety has always been my priority, but right now, I think safety is on a completely different level because of COVID. But I'm excited, and I think my staff is excited, and I'm really just anxious to see how my students respond as they come in the building here in a few minutes. So,
tell us how the planning has been for you. I mean, you're on the ground, you are in the school. What have you been thinking about to get ready for today?
Yeah, the planning has been really, really meticulous. And I think a lot of times, what we see in the public is like the governor will make an announcement, or even like at the school district level, our school board will make an announcement, or our superintendent will make an announcement as far as how we follow the data and how we want to prepare for school to reopen. But as you said, on the ground in the trenches, the logistics of getting from like the school bus through a classroom to the end of the day, it's been eye-opening, and it's had to be a collaboration with like school administration, teachers, counselors, my custodians. There's been so many people in the trenches building a plan that we're going to execute today.
Yeah, well, I will have to follow up with you and hear how it goes. But I appreciate you mentioning all the people that are really critical to making this happen. It's not just about the students, but it's about their parents, their families. It's about your staff. It's about all of your staff, your teachers, the people who are supporting all of you. And I think I really appreciate your comment too in terms of how it is to be on the ground once you have those policies that are told to you and practices that you're supposed to implement. And we look forward to hearing how it goes.
Yeah, we're excited. And we've actually, we've made a plan. Then we went to a plan B, a plan C. I think we're on plan B by now, just with the nature of, learning more about this COVID-19 that it really shut the system down back in early March. But it feels as if every month we get maybe new data and new ideas around best practices. And so we've had to plan and plan again and plan again. And so again, I feel good about where we are today, and that's why kids are coming back.
Yeah, I want to lift up your emphasis on data. Making data-informed decisions is critical in this time. You are at a Montessori high school, which I didn't realize are pretty rare in the U.S. And I want to, in the context of thinking about education and its connections with health, talk to me about what being the principal of Montessori High School means for the kids in your school and how you think about health.
Thank you. It's very rare from a high school standpoint in secondary education. And what you often would see is the Montessori programs from a preschool through an elementary school and even a junior high. but especially to carry that philosophy through the high school grade levels. That's the part that is really, really unique. And there's only really a handful of public Montessori high schools in the entire country. And for someone like me, that makes me excited, Keisha, because I get to be creative in leadership. I like to talk to my staff here about we're doing something to where we're the trailblazers for other public school districts to kind of really watch and learn how you do education with this Montessori philosophy. And the Montessori philosophy, I think, plays really well when you talk about health and well-being in the whole child. And so those are things that a lot of people are interested in lately. And here at Gamble Montessori, we've kind of been ahead of that curve a little bit. And so it allows us to be creative. But at the same time, there's a philosophy that's really, really strong at the primary level. And we do the best we can to execute at the high school level.
I really appreciate your emphasis on creative leadership. Can you give us an example of something creative that aligns with this emphasis around or our interest in health and well-being that the listeners could hear? Yeah,
absolutely. And so, again, part of what we do is like take the classroom outside of the traditional classroom. And so our campus, a lot of green space, even 2 years ago, we were prepared for outdoor classrooms, right? And so we've got maybe 20 different picnic table setup areas outside. We've got a garden, a nursery. There are so many opportunities on our campus for students to leave the traditional classroom and go outside on campus and interact with nature and use their hands and a lot of hands-on learning. And so you fast forward to a COVID pandemic when you are going to prioritize space and distance and not being side by side with your fellow students. We already had some of our infrastructure set up to allow us to get outside and take advantage of some of those outdoor classroom spaces. So that's something that's small, but because we're a Montessori school, we already had that advantage built in.
And there's so many connections between access to green space and health. And I mean, you're in a city. It's not like, let me break this down for listeners. You're not out in some rural area of Ohio. You are in a city. So talk to us about the importance of that access to green space for kids coming from urban environments.
Very rare. And that's one of our key and critical programs that a lot of families choose our school because of. It's basically horticulture and agricultural and food sciences. And so we are Cincinnati Public. Our district has 36,000 students. We're one of only 2 Montessori high school offerings in the entire city. And within our program embedded is a horticulture and agriculture program that gives students access to farm skills, to food sciences, really just being self-sustaining. And basically we say from the farm to your table. We want to teach our students to go through that entire process. And we've got a really good reputation and track record of doing that. And it does attract a lot of families.
Mm-hmm. The emphasis on food and agriculture is critical for health. Do you see kids in I know you're a Title I school, tell us what that means. And also if you see issues around food security being important for kids in your school.
Very important. And we've got, I think, maybe 3 or 4 programs to attack food insecurity or food scarcity types of issues. And so we are a Title I school. Our entire district is really a free and reduced lunch district. We're right in the middle of Cincinnati. Our school specifically, about 80% of our students would qualify for a free or reduced lunch. And so not only do we have programs to really teach our students what it means to go from A to Z, to plant seeds, to watch them grow, to nurture them, to be able to take care of a garden, a farm, or a nursery and provide for yourself. But we also have really nice partnerships here throughout Cincinnati. The Free Store Food Bank has allowed us to set up an in-house school pantry. The Cincinnati Public School District, especially over the last few months where students have been learning from home, we've provided weekly meal kits for our students. So every Wednesday, students and families can drive through our campus and get enough supplies to last for 5 full days. In addition to that, we've got a few partnerships with local churches that provide food on the weekends for our students. And so not only do we have courses and classes that can attack this issue, we also have partnerships to help out.
We started this conversation by talking about COVID, and this is a really tough time for families. There's a lot of job loss. Families are struggling. And are you seeing a greater need now, even more than before, in terms of all of the job loss and the economic impacts of this pandemic?
We are. I think the 2 things I think that have really been right in front of me is the noticeable, and I think really just the goodness of people speaking up with the stress they're carrying and how that plays on a lot of my students and families and my parents' mental health. And, parents having their youngsters at home for an extended amount of time is a lot different than what we're used to. And so I think not only the food piece, but the mental health, and then I have to say the technology. That was one of the big learning points for our school in our district, maybe in the March, April, and May timeframe. We got some partnerships established here in the city throughout June and July to ensure all of our students had one-to-one device capability to start this school year. So from mental health to food and technology, those are really some of the biggest issues over the past few months that we've tried to attack.
And now as kids are coming back and you talk about these challenges around mental health, food scarcity, food security, dealing with technology, I mean, do you have concerns about kids who have maybe fallen behind the last few months, or what are you thinking in terms of the potential long-term impacts of being home for a few months of where kids are now?
So I don't have the answer, but I'm very concerned about the learning loss. And I think the research will tell us that there's always kind of that summer learning loss, and depending who you are, what your family's socioeconomic status is, you have different opportunities throughout the summer for mentorship programs, tutoring programs, summer camps. And in the environment that I'm in the middle of Cincinnati, a lot of students may not have that. So there's a natural summer learning loss that's been documented over the years. So now what we've done is we've magnified that by 2 or 3 with the nature of not being in school since March. And so I'm very concerned. And honestly, Keisha, it's my prayer this morning that, what we've done over the past 6 months from today, we can reflect back on and be proud of it. And then I think what I really want to have the time is maybe 6 years in the future is to look back at this historical moment and feel like we're on the right side of history. We made some good choices for kids and families. But I think the last 6 months and the next 6 months are just really critically important. And so I don't know what the results will be, but we're going to go through the process and do the best we can.
Mm-hmm. And are you planning to increase your mental health offerings, or how are you thinking about supporting kids? You mentioned mental health being an issue that's come up for them.
Yeah. Again, we have, our school, last year we bumped up from 1 school counselor to 2 school counselors. We have a partnership with an agency called Central Clinic that provides the clinical counseling for our students. We also have we've gone from 1 in-house school psychologist up to 2. And so we're really just looking at staffing and bringing the professionals into the building to really just kind of take away one of those barriers, which can be transportation and access. So we make space. We flip classrooms into offices. We flip closets into offices. We try to bring the professionals and experts into our building to have easier access to our families and children.
Yeah, I really appreciate that and really acknowledge the great work you're doing to reduce that barrier, right, of parents having to take kids to providers outside, but bring them into school so that the kids can access these resources throughout the day. In addition to the pandemic of COVID, people talk about we're in this time of this dual pandemic of racial injustice that has always been present, but has really been magnified in the last few months, particularly in light of the killing of George Floyd. And wondering, you're at a school where about 74-75% of your students are Black or African-American. You're a Black man as a principal. Can you talk a little bit about how you see what's happened since the George Floyd murder affecting your kids? How is that playing out in your school?
I think this is a very interesting topic. I'm calling it pandemic number 2 because it's really kind of rocked our world to the same level as COVID-19, maybe just in a different kind of lane. And so specifically at my school, I'm excited about the commitment of setting a school-wide goal for the staff to do monthly professional development to learn more about anti-racist practices within our school. So doesn't mean we're going to solve racism that we all know exists. Doesn't mean we're going to eradicate police brutality, which obviously when you talk about George Floyd, we all know that exists. But what we're committing to at my school is to be intentional about training and learning on a monthly basis for the duration of the school year. And so I feel that is a really big commitment by my staff. The reason we can do that is because our school board has actually moved quickly to adopt new policy. We've already had policies around equity and providing access to all students. But here in Cincinnati Public Schools, we actually adopted policy 2255, which is very clearly specific about anti-racist schools, practices, and communities. And so Keisha, as a school leader, having the board policy gives me a little bit of protection and cover to push this conversation forward.
Have you, I really acknowledge the great work and applaud the school board for lifting up anti-racism in particular. Have you found staff being resistant to this? I mean, not to say that people are, not supportive of anti-racism policy, but this is a whole new level, right? Like you're gonna, sounds like you are about to hold people accountable for things that maybe they weren't held accountable for in the past. So talk through that a little bit for me.
We are, and I like it because a lot of folks are uncomfortable. And I really enjoy that because I know our teenagers and our students are not going to hesitate, right? They see what we see, they feel what we feel. And so the way I view it is it's my job to really push my staff a little bit outside their comfort zone because we've got to be at least somewhat equipped to manage the space when our students come back. So I like the fact that some folks are resistant. I think that's natural and that's just the society we live in. That's okay. And the goal is to stay engaged and keep learning, right? It's not to prove right or wrong. As much as I want to end racism, this is a historical decade after decade after decade issue. So our commitment is to being comfortable leading our classrooms, to learn intentionally on a monthly basis. And you're right, the folks that are resistant, I think that's okay. It's my job to prepare them to have the conversation and probably let the kids solve this whole racism topic. If adults could solve it, we would have done it by now. So if we can just kind of stay out of the way and allow the kids to create something, I feel good about that.
I suspect that you are one of the few Black principals in your district, and maybe the only. I know I'll let you correct me on that. But wondering how are you approaching anti-racism in this space as a Black male, as a Black principal, and how is that for you? How personal is that for you? Talk to me about that.
So I really, one thing I love about Cincinnati Public is we've got 15 high schools in our district. And believe it or not, this is going to blow your mind. We actually have 8 of the 15 high school principals are actually African American males.
Really?
So I've not done my homework yet, but if you look throughout the state or just at like similar urban large districts in the Midwest, I think we have tapped into something that we should probably be a little bit louder about here in our district. But I have a nice cohort of colleagues that I can call when I need to vent, that I can call when I need ideas, or really just for some guidance as I'm still on the front end of my career. I do feel good about having colleagues I can call across the district. And as a whole, there's a few things that I think Cincinnati Public is really just crushing it. And I don't know if everyone knows, maybe especially out on the East Coast or West Coast, the fact that we've got significant women leading our district from upper management. I think 80% of our senior leadership is women and African-American women. I think we should be proud of that and we should talk about it. At the high school level, like I said, 8 of 15 high school principals are African-American males. I don't know if everyone knows it. I know it and I love it. And then the last thing, Keisha, that I don't think anyone knows about is the way we take care of our foster care students within our district. Cincinnati Public has a phenomenal program. So where if you look across the nation, kids in foster care graduate high school at a rate of about 50%. Here in Cincinnati Public, over the last 11 years, we average about 95% graduation for those students. So there's some cool things happening here from like leadership, African-American and women, but we also got some cool stuff going on for kids as well.
I'm very impressed. Cincinnati Public is clearly doing it up. And I appreciate you lifting that up because, I'm in Maryland. I did not know about those stats and really impressed that 8 of the 15 principals in your high schools are Black males. I think for young Black boys and teenagers to see Black men in leadership, I think that is critical. And I applaud your district for making those hiring decisions.
Thank you. And I think it's just, the easy thing is to lead and model and allow students to see you can be successful and you don't have to get into some of the traditional stereotypes, right? You can be creative, you can enjoy, and you can have a really, really bright future doing whatever it is you want to do. And so the first thing I do every day is just really try to speak life into all my students and keep them inspired to show up tomorrow and keep trying.
That's great. Thank you for saying that. And having kids who are in your school, in your Montessori school, with your approach also gives them access to those health supporting resources that we talked about earlier in terms of green space, mental health, these other important services that can help support a whole child mentality.
Absolutely. And I think a lot of students, our school's a little smaller compared to some of the other high schools in the district, just by the nature of our program. But when students come in and they spend some time here, they end up falling in love with our school. And that's something I'm proud of because of the programs, the way we take care of the whole child, some of the mental health aspects of getting out of the traditional classroom, interacting with nature. We do a lot with mindfulness. And we have really tremendous resources from school counselors, school psychologists, and clinical counselors. So it does come full circle.
Yeah. Well, Mr. Taylor Porter from Gamble Montessori High School in Cincinnati, Ohio, I want to thank you for your time today. I know that you are eager to get outside and welcome your kids back on campus for the first time in nearly 2 months. My hope is that today is a great day for you and your staff as you prepare to welcome them back. And just really thank you for sharing these insights with us in terms of how education connects with health in your school, and what you're doing around racism and to support foster kids in foster care. So thank you again for being with us today.
Thank you for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.